Hello, ladies and gentlemen, brothers and sisters, sickle cell warriors. Um, Today I guess I'll be teaching you guys about sickle cell and how barometric atmospheric changes or barometric pressure, atmospheric pressure, whatever you want to call it or know it as, how it affects sickle cell. Um, you know, anyone can watch this video and learn from it, whether it be people with sickle cell themselves who didn't know. Um, Of course, pediatrics with sickle cell who are still learning about it, older people with it who have never been taught it or learned about it or just never noticed it. Maybe you did notice it but didn't know what to call it. And even doctors and nurses and those who study hematology and currently practice it. Some know about this, but not all do. I have come across doctors and nurses who have never heard of this or discussed it. With another hematologist or sickle cell patient before and have either learned it from myself or at least were introduced to it from myself before they did further studies for themselves to learn something. So basically, with sickle cell and barometric or atmospheric pressure, um, like that pressure is the pressure that's like within the earth itself, and it kind of that air itself, it surrounds us. And with bad weather, the pressure becomes lower. And the lower the pressure is, it causes our tissues to expand. And when your tissues expand, that can cause pain in the joints and things like that. And with sickle cell, it can cause crises, whether the crises is in your back, chest, legs, arms, wherever. Um, so yeah, it can cause pain within people who have arthritis, or just older people, someone who's suffered an injury. Like if you've ever heard an old person say, "It's gonna rain, I can feel it in my knee," or "I can feel it in my bones," something like that. You may think that's just old people being crazy, crazy talk, or people just being funny, or just whatever, nothing to take seriously. But it's a true thing. I myself can sometimes feel it like weeks before it's gonna rain, or like a snowstorm, or even a bad thunderstorm, or just the weather's gonna flip in some kind of way. You can kind of feel it in your body before it gets here, because your body reacts to the changes in the atmosphere. Like even for people without sickle cell, your body reacts to it. And it may not be to the extent that someone that like arthritis or sickle cell may have, but your body still reacts to it. Um, you know, it's how people can get like sick and things like that. Your body reacting to the changes in the atmosphere. Um, and not saying that it will like lower your immune system, because it doesn't, but like it affects your body in a way, um, where your um immune system could be temporarily weakened, or it can affect your body in a way um that allows you to become sick, or even you become sick within your body. Like your body itself has made you sick, and nothing from the outside has entered to make you sick. And that's especially true for us with sickle cell. The changes or the things that make us sick with the barometric atmosphere changes usually start at home, like in the body. It's not caused by something entering the body, like a virus or something like that, or bacteria. It's just the sickle cells that our body is already producing, um, and how the tissues are expanding and things like that. The cells could just get lodged and wedged into places where they don't belong, causing pain like in those joints or in those tissues, those muscles and things like that. Um, so that's kind of like how it can affect the body. Like, for example, I was in the hospital once, and I was already having a very bad pain crisis. I was having chest pain. And while I was already there, chest pain got worse, and it was really bad for like 4 days. For 3 of those 4 days, it was because a storm was coming, which is why it got worse. Nurses couldn't figure it out, and it took one of the doctors, one of the specialists, to come and say, "Hey, The reason his pain has gotten worse is because his body is reacting to the changes in the atmosphere. Those barometric atmosphere changes. His body is reacting to it, and it's making his crisis worse. Again, it can make them worse, or it can even start a crisis. You could be totally fine next minute. You're sickling because it's gonna rain tomorrow, or rain a couple of days off, or it could be raining and it could switch up on you and it's gonna become like super sunny in a few days off. The rain's gonna vanish and it's gonna be 80s or like mid 70s low 80s next couple of days. Even changes to better weather could make you sick. So those are things that we have to like pay attention to. Pay attention to your body. You know your body the best. It'll give you signs, it'll give you signals that a crisis is oncoming. I often tell my doctors about this feeling I often have. It's like a sixth sense. I know when I'm gonna get sick, and I know when it's gonna be a particular bad episode. Because I have this sixth sense about it. I get like this. One call it a head rush. It's like this tingling feeling in my head. It's not an actual physical tingling. It's not an actual physical feeling. Um, but it's like I feel something, it's I don't know. Let's say it's like my spidey sense for knowing that I'm going to have a very bad crisis coming on. It's kind of like that. When I get this feeling, I know ahead of time that I'm gonna get sick, and I may even prepare for it. May get a bag ready for a hospital. Shower in advance, things like that. That way, when it happens, if it's not something I can handle at home, I don't have to worry about getting things together because I've already prepared for it because I've gotten that feeling in advance, and it's never been wrong. So yeah, you know your body the best. So it's like best to pay attention to that. Also, if you don't already have a weather app on your phone, I would download a weather app or just pay attention, watch the news, watch the weather section, pay attention to the forecast and things like that. They're not 100% accurate all the time, but it could be a very good indicator of how your week is gonna go. And sometimes your body will know better than the newsman. Sometimes they could predict what's that no rain or nothing bad for a whole week or two, and maybe rain in like the third week, but in the second week you start to get those feelings, or even in the first week, because in the second week the rain decided to show up a bit earlier. So those are things you want to pay attention to, and that's kind of like something that I know a lot of people don't know about. But yeah, I hope this video was educational. Hope it taught you something about your body, how it reacts to the barometric atmospheric changes, whether you have sickle cell or not. But yeah, I would you know, hopefully, if you haven't learned this before, I did teach you something. Um, and hopefully, maybe it's something you've noticed but never knew what to call it. That's what you can call it. You can just say your body is reacting to the atmospheric changes or barometric pressure, atmospheric pressure, whatever you want to call it. Um, but you guys have a great day, and I will talk to you guys later. Bye bye.